Right, then in that case, what I'm going to do is maybe I'll ask Representative Katiz-Ratun if you'll move House File 5267 to bring that before us.
So moved, Mr. Chair.
Thank you so much. And then, members, there is the A24 amendment, which I think there were a couple of riders that were missing from, it's the A24 amendment to kind of add in those pieces. It was discussed in the presentation. These relate to food security. So Representative Katiz-Ratun, if you'll move the A24 amendment.
So moved, Mr. Chair.
Thank you. And I should have noted that we do, in fact, have a quorum. That was something I should have noted before starting all this, but we certainly have had one for a while. Any discussion of the A24? Not hearing any. All in favor of approval of the A24, please say aye. Aye. Any opposed? Okay, motion passes. The bill is amended. And there are no additional testifiers signing up in advance, but anyone who wishes to testify on this bill, which is really the governor's budget proposal in the human services area, please make your way up. I don't know if there is. I kind of thought that there was somebody, but perhaps not. All right, I think there may be information in our packets with some public input as well. Oh yeah, a couple of letters. So, all right, well, so there we go. So now moving back to member discussion, Representative Coulter, you were next up on the list.
Excuse me. Thank you, Mr. Chair. So I have just a few questions about the weighted risk system. And I, first of all, want to say that I'm really glad that we are moving away from the fix-it ticket system. This is something that I've heard pretty consistently from providers that we do need to change. So I just sort of, first of all, question of clarity on the language. So the weighted risk system, the language in the bill repeals the current section of statute that contains the fix-it ticket system. So if and when this becomes law, then sort of immediately this weighted risk system takes the place of the fix-it ticket system. I'm also glad we're getting rid of it because that's not an easy phrase to say.
No, bit of a tongue twister. Yeah.
So am I correct in sort of there's that sort of seamless transition? There's the fix-it ticket system now, and then immediately the weighted risk system.
And if you could work in the phrase "fix-it ticket system" repeatedly in the answer, that'd be great.
At least 3 times.
3 times, yeah. Okay, Ms. Bailey.
Mr. Chair, Representative, that is correct.
Okay, thank you.
That's good.
Just a few more questions here. So currently, correction orders are, as I understand it, they are not appealable. That is to say that these are sort of internal decisions within the department, that there is no process for appeal to say an ALJ or anything beyond that. Am I correct in that?
Director Bailey.
Mr. Chair, I'd like to phone a friend.
Yeah, I can imagine that's probably in somebody else's area of expertise. Let's see who's coming up. Looks like Mr. Hosh. And once you get settled in, if you just identify yourself and then proceed. Glad to have you.
Thank you, Mr. Chair. Larry Hosh, Manager, Office of Inspector General Policy. Representative Coulter, for correction orders, a reconsideration process can be undertaken. It's not a process of going to an administrative law judge, but you can have reconsideration.
Okay, Representative Coulter.
And thank you for that clarification. And that is an internal process within the department, correct?
Mr. Hosh.
Mr. Chair, Representative Coulter, correct.
Thank you.
Representative Coulter.
Thank you, Mr. Chair. And my understanding then is that would not, with the implementation of the weighted risk system, that would not change, correct? That correction orders would continue to be, would not have that appeals process anymore.
Mr. Hosh.
Mr. Chair, Representative Coulter, with the rated risk system, we would have documented technical assistance for low-risk violations, which kind of mirror what the fix-it ticket process was. There would still be correction orders for standard violations and potentially negative licensing actions on high-risk violations.
Representative Coulter.
Thank you, Mr. Chair, and thank you for that clarification here. And I guess sort of the reason that I'm bringing this up is that my worry is that with the new weighted risk system that, again, I do absolutely believe we need to implement with the current correction order system, that we are in essence sort of creating a 2-tiered system where it sort of allows the department to not dismiss but sort of I can't think of a better word, but sort of dismiss some lower level violations but not others. And I'm just a little bit concerned about that being an entirely internal process, particularly when we're thinking about these correction orders, because these are obviously the kinds of things that can make or break a provider and make the difference between them staying open and not. And so I guess I would just, as things move forward, I just encourage the department to consider some kind of sort of external appeals process, just to sort of make sure that we satisfy due process, that our providers are being taken care of. So, thank you.
Thank you so much. We will keep moving then. Representative Zalesnikar.
Thank you, Chair, and thank you for the presentation. I appreciate that $15 million has been allocated, from my understanding, for the IT, for the SSIS system. I guess my concern is, from listening to previous testimony, if I understood it right, the system costs like $80 to $100 million. And so I'm curious as to the time frame. At what point will this system be installed, fully funded? Is there a strategic plan for that from the department?
Director Bailey or Commissioner? I'm not sure who the right person is. Commissioner.
Thank you, Mr. Chair. Yes, I'll take that one. So you're correct. The initial estimates that we have seen from other states and received from our conversations with other vendors are that, in fact, it may take 80 to 100 million to completely replace the system. Our $2 million investment last year took us a step forward in some of the research and technical assessment and determining the user experience needs for the SSIS system. This proposal does take us one more step forward in more incremental fashion. That does not, in fact, move us towards a complete overhaul. However, we do think, given the large investment, it does make sense to take varying steps along the way to help stabilize the system and make some efforts to improve it in the meantime. We have a vendor that we will be, we have a request for a proposal right now for a vendor that we will have a report due this summer. And so we'll have, based on that information, a much more strategic plan in terms of the timing and the actual amount of dollars that it will take to replace the system in Minnesota.
And maybe I can just clarify before sending it back. My understanding is 80 to 100 million, of which we would expect a 50% federal participation, so it'd be 40 to 50 million in terms of state cost.
Thank
So,
you.
Okay, I just want to make sure to be clear on that. Representative Zalesnikar, back to you.
Thank you, Chair, and thank you for that information. I guess I'm very concerned. March 29th, the Star Tribune did an article on the impact for counties, and there's tremendous testimony in that article that talks about the turnover. 40 to 50% of county casework turnover is related to the primary reason is, guess what, SSIS. And the secondary reason is SSIS. So while we put 20 million, I believe, to create this new department, we have not created the fundamental horse, which is needed to do the maltreatment systems. We have no ability to do simple things like copy and paste. So the information is being tremendous labor intensive. It's created an environment for that. So I appreciate all the initiatives and support the initiatives that you're doing. I just have a serious concern, and I think this committee needs to. We are not going to be able to deliver because the maltreatment reports, the out-of-home placements, adult, child, mental health, services to elderly, and people with disabilities all run through SSIS. And then we have MMIS that deals with the healthcare side. And both of them are antiquated systems. So we haven't even addressed that, and we don't have a plan to address that. And this committee has to seriously address that. So the initiatives are great, but if we don't have the ability in 2024 to have the infrastructure, I don't see how we're moving Minnesota forward. And I'm going to say that for every time I can, because I am getting bombarded by people in the counties. St. Louis County is the biggest county in the state. And we are handicapping people to be able to serve the people we are all here to represent. And especially in greater Minnesota, when you need the technology to communicate, and you're in the field, and your drive time to get back to a computer to do this, we are all here on our phones communicating, and we are not setting up our people in government and state offices and counties to do their jobs. And I just want it to be noted on the record, I'm extremely disappointed that we are adding carts without the horse. Thank you.
Thank you, Representative Zalesnikar. Representative Nelson, to you.
Thank you, Chair Pinto, and I guess I will say on the the SSIS system, thank you for the $15 million request for it. However, I think I will echo much of the concerns that Representative Zalesnikar said. Is it's a big system, it's complex, and I think compartmentalizing and changing some things as a step is important. There's I think 30 some different programs that are run underneath of it, and I think maybe focusing on the children part of it is maybe the best step initially, but I just I know we don't have a great budget right now. At the same time, I worry we're not spending enough on this and making sure that we're really doing this system the justice that we need to. This was rolled out in 1999. That's 25 years ago. It's a little bit hard to believe, but some of the computers that are still required in the SSIS system, you can play Oregon Trail on it. And so I don't know. I mean, this is a little bit outdated here, and to think of how the computing technology has changed, is badly needed, and I think it's a little bit of an embarrassment on the state that we haven't addressed it before this. But I am thankful that it is being addressed, and I think if there's any way we can find in the cushions some additional resources to be able to make a bigger impact on the SSIS system. But thank you for your work on this, and I think it's something that we need to continue to work on, because our social workers are really frustrated with the system, and many of them are not doing really the work that they want to be with the actual children and the families that they're there to serve. And they're frustrated with the technology that they're being required to use. So thank you for the investment, but at the same time, Chair Pinto, I would ask if there's any way we can find any more, let's do that.
Thank you, Representative Nelson. Representative Katiza-Tune, you're up next.
Thank you, Mr. Chair. And I want to echo the frustration and the concerns of my colleagues on both sides of the aisle. I mean, this is something that we've been talking about all session. We've been talking about this for years. And I want to acknowledge the frustration that the department currently has with the system. It is not that you think everything is unicorns and rainbows. I mean, I know that your staff and the counties are struggling under the weight of this system. And this is not a problem that happened overnight. It didn't happen from 2023 to 2024. It didn't happen from 2017 to 2018. 25 years we've been working. And these changes, the leaps and bounds that technology does overnight sometimes is just really hard to keep up with. So, I mean, acknowledging that this has been a struggle. This is not something that we are going to be able to fix overnight, because setting up a system for success for the future takes time. But I think it's really important, the report that's being requested, that we can really set out a positive pathway for success is going to help us revolutionize, hopefully, the services that we're providing for people. And this is something that people are struggling with across the state. It was actually an SD 49 resident who invented Oregon Trail, so I appreciate that shout out there. And it was one of my favorite games in my childhood.
That's a deep cut constituent call out there, Representative Katiza-Tune. There you go.
Hey,
Yeah, impressive.
I digress.
Yeah.
But I mean, we know that social workers and county social workers across the state go in, they log in, they put in the most comprehensive report that they can based on their conversations and their meetings and all the work that they're doing to support families. And then if the system doesn't save it, then they have to go back in, and it's probably a summary of that first report. So we know that we're not getting the best information. I mean, and I think as one of two Hennepin County representatives on the committee, I just want to point out that 22% of the state's population resides in Hennepin County. So I know very well the struggles of the caseworkers in Hennepin County here in the largest county in the state, population-wise. So I think that it's something that we do need to continue talking about, but I want to recognize that these concerns are not just from the minority or from the majority. I mean, these are not things that the agency is ignoring, and I appreciate the work and time that you guys have put in and come here to talk to us about so that we can, going forward, make this work better for everybody.
Thank you so much, Representative Katiza-Watoon. Looking to see if there's other discussion or questions that folks may have. Yeah, Vice Chair Keeler, certainly.
Thank you, Chair. I do just want to follow up on the SSIS. I think we've all said it, right? There's like mass frustration around it and we need to work. But when it comes to choosing the vendor, and I was trying to look through the language to see if it's in there, but one thing that we learned with the vendor for background checks is there's this like domino effect that the vendor that does background checks is actually based out of the United States. And so is there comfort language, or actually not comfort language, real language that we can put in this to make sure that whatever vendor we choose to help build a system to keep all the information on our children is not being like, doesn't have the steps that it ends up out of our United States borders. I think it's just really important, and we see how many issues we have with background studies here. Not that I can tie those things together, but I think it does create a different issue for us to hold a vendor accountable when we see that happen. So if it's in here, I'm sorry I couldn't find it, but I just wanted to also make sure that we have that on the record, that we can make sure that that is some language that's in here. Thank you.
Thank you so much. Yeah, and if there's certainly Commissioner or Director Bailey, if you have anything to say about any of these things, feel free to do so. I think we may be done with member discussion or questions at this point, and so yeah, so Commissioner will allow you to say anything that you wish, or Director Bailey, about any of this.
I'll just make a quick note that I appreciate the call out about the vendor, and while I don't have that at the tip of my fingertips, I will make sure that that language is part of our vendor selection or part of our contract process with the vendor. So I appreciate that. Thank you.
Thank you so much. Yeah, good. And another note, members, so this has been the presentation flowing through our human services side of our budget, which includes the Department of Children, Youth, and Families side. We will receive a presentation on the education side. There's no target in that area. We don't have a net positive spending that we are able to do. So there's just a few sort of cost-free items. And so that'll happen next week as part of our budget bill because the MD staff are tied up today and we just sort of couldn't make that work. And again, there's not additional, there's no positive target there. So just to kind of have folks be oriented. So seeing if there's anything else, doesn't appear that there is. So thank you so much to the testifiers and to everybody who's working for these agencies, how incredibly hard you're working. With that, the chair lays over House File 5267 as amended for possible inclusion in a budget bill. Thank you so much.